Prior to my treatment, I was urinating frequently throughout the day and getting up a lot after we went to bed at night. And I became aware through my annual physical that I had an enlarged bladder. And so I was then referred to a urologist who, I hadn't been going to a urologist for years. I knew I had BPH, and this goes back a number of years. I had been engaged in watchful waiting. Had some biopsies over the years, and they were all negative, so I knew I wasn't dealing with a cancer situation. And I was just adapting to it and living with it, and then turned out that my bladder had expanded to the point where I was retaining a great deal. Well, interestingly, how the symptoms impacted my life was they didn't, except for getting up during the night several times to urinate, and so that interrupted a good night's sleep for both of us, as
Yes.
I'm sure you recall. But it turns out that over the years, my bladder had just expanded to accommodate this situation, and I had no discomfort. And I was shocked to find out that I was retaining as much as 1,500 cc's, and which is a huge amount. And then, at that point, you have to deal with the possibility of damaging your kidneys and etc.
Well, I did feel that there were things that weren't quite right. You certainly weren't sleeping well.
Right.
Because along with getting up in the middle of the night, then you don't always go back to sleep right away.
Right.
So
Which
I
means you
also
don't go back
I
to
also
sleep
was
right
not
away.
sleeping very well, and I think you had some digestive issues that may or may not have impacted from the expanded bladder. He just wasn't quite himself. Hard to put my finger on it, but there was something going on. But we really were not aware of what it might be until he had the test.
Right, right. And then once I knew what I was dealing with, then I knew I had to take action. So I was referred to the urologist. And when I saw him, he put me on medication and suggested that probably the best course of treatment, at least from him, was to be a surgical procedure, a resection of the prostate, a TURP. Saw the urologist again, and he reiterated the same course of treatment with only a 10 to 40% chance of a positive outcome, and failing that positive outcome, I would have been stuck with either a full-time catheter or at the very least self-catheterization several times a day. And so at that point I started to look into other options. Through a family member, I heard of Dr. Pugash. I went on his website, listened to some of his instructional videos there, and decided that this was somebody I needed to talk to. We had our consultation, he examined me, and in his opinion, the best course of action was Prostiva. And when I listened to the probable outcome and the minimally invasive nature of it, we just looked at each other and said, this is what it takes, this is what we're going to do. So we made an appointment for February. We just went ahead and never looked back. I was certainly nervous about it, not only in terms of was it going to have a good outcome, but were there going to be any complications along the way? You always wonder about things like that. Then I was shown into the room where the procedure was going to be. Got settled on the table. The doctor was in just a few minutes. They did have a nice TV screen mounted on the ceiling, so I could occupy myself that way. He came in. He was very reassuring. The procedure, as he said, only took 30 minutes or so, and there was an anesthetic administered, although it wasn't complete anesthetic. I was awake, obviously, during the procedure. The comfort level, I have to say, was much more than I could have hoped for. On a scale of 1 to 10, 10 being a great deal of pain, when there was discomfort, and that's all I would call it, is discomfort, not true pain, I would put it at maybe a 2, and it was intermittent. The most noticeable effect was a feeling of warmth as they heated the tissue, and they do this in bursts of a couple of minutes each, and he would let me know when each one was coming, and after the first 2 or 3, I didn't even really bother tensing up for it or anything, because there was just really nothing to it. I mean, I've had dental procedures that were more rigorous than than this. They inserted the catheter, and I waited just a few minutes just to make sure that I had no dizziness or anything like that from the procedure. I felt fine. I definitely feel I'm ahead of the game as compared to where I was before I came in here. I'm not getting up as frequently during the night. I'm urinating stronger, more volume, and you know, it's funny, you get used to things, especially when things happen in incremental progress. And I had this for so many years and not been aware of it that you forget how it's supposed to be. And I just realize how abnormal things were before I had the procedure. And I'm not 100%, and obviously I'm not, you know, my body isn't performing like a 20-year-old's because I'm 67. But frankly, and this is an ongoing process, it takes several months to fully assess. But if it didn't get any better than it was right now, I could live with this very happily for the rest of my life. I'm that happy with the results. I'm sleeping better, which means Shelly's sleeping better. I'm just getting up with starting the day with a better outlook, knowing that I can just do things that I was sublimating before and not even necessarily realizing it. I would absolutely recommend this procedure to a family or friend. As I said, I'm much better off than I was beforehand. It's minimally invasive, has a good chance of a strong positive outcome, and to me anyway, it's much preferable to full anesthetic, going in the hospital, having a full-blown surgical procedure, and sometimes that's necessary, but I think everybody owes it to themselves to investigate the options.